Hi, I'm Dr. Jeffrey Garofalo, author of Never Look Back, a simple guide to the causes and care of back and neck pain. If you're here, you've either purchased my book or someone's told you about our free back pain tips website. And for that, I appreciate both of that. I'm a 20-year chiropractor and veteran of non-surgical spinal disc care. If you're here today, you're looking for some solutions for neck and back pain, obviously non-surgically. So in today's video, I'm going to share with you a couple things, and we're going to break it down into two parts. The first part I'm going to share with you is how to get rid of neck pain and back pain and muscle spasms non-medicinally, naturally. And then in the second part, I'm going to share with you some stretches and some exercises that you can do to prevent future neck and back pain. Again, if you've purchased my book, I greatly appreciate it. If you have not, I highly recommend you grab it, as it's a simple cause and care of back pain. We give you simple solutions to why you're having your back pain, your neck pain, and then we give you simple causes and solutions. So without further ado, let's jump into it and let's give you your first tip. Tip number one, to reduce neck pain, back pain, and muscle spasm naturally without medicine. So there's many of my patients that come in with neck pain, back pain, and muscle spasm, and they use this one thing that they absolutely love because it feels oh so great. And we call this the heating pad. And so it feels great, but what I actually tell my patients is to not use a heating pad. And the reason is because it is dry heat. When you put dry heat on your back, it feels good because it relaxes the superficial or the muscles that are closest to the skin. It draws blood deep from the tissues, the joints, and the blood flow goes up towards the heat. It opens up blood vessels up there, it relaxes muscles. The challenge is it dehydrates the joints and the deep muscles. So within a couple hours, although it felt good temporarily, it dehydrates the joints, and now you start feeling the pain even worse. So what I tell my patients is, take this thing, this heating pad, and get rid of it. So what I clinically recommend, and what we've seen for quite a long time, and what I personally clinically recommend for my patients, is to do something called contrast therapy. So what I recommend they do is they grab a cloth, they heat it, in other words, moist heat. Put it under hot water, as hot as you can get it without burning yourself. Or you could take a hot shower, a hot bath, or a hot tub. I recommend to start with moist heat. So if we were going to use this towel, we'd get it as hot as we can get it without burning ourselves. We would put it on our neck and our low back. We do that for 10 minutes. Or we could sit in the bathtub or the hot tub or stand in the shower for 10 minutes and let the water hit the area of discomfort, pain, muscle spasm for 10 minutes. Because the moist heat, the water, will drive down deep into the joints, past the superficial or the muscles on the surface, go deeper into the deep muscles, and then deep into the joints towards the spine. As the water goes down, healing blood starts to follow and starts to heal and relax the tissues, but it also creates blood flow deep, deep, deep where you want it. So first we recommend either a hot wet towel on the area like the neck or across the low back. Or you can do a hot shower, or you can do hot tub or bath for 10 minutes. And then immediately after that, we recommend an ice pack. I like to use these gel packs in my office. We have our patients put a paper towel around the gel pack and then either put it on the neck, and they're gel so they conform to the neck or the low back for 10 minutes immediately after the moist heat. Because the cold now will reduce the amount of blood supply, reducing the inflammation and pain. So you get the best of all worlds. You get the moist heat to relax the muscles and drive blood supply deep into the joints, and then you get the ice right away to reduce inflammation. So I highly recommend we go 10 minutes of moist heat, 10 minutes of ice, and an hour later we use the ice again. Now remember this. The tips I'm giving you here are natural pain relief tips. They're not going to solve the problem because we don't even know what the problem is yet. And in my book, Never Look Back, a simple guide to the causes and care of back pain, in that book, I share with you the different components of your back that can be injured and how they may hurt. And I share with you and your doctor ways to discover and diagnose exactly which parts that need help. So again, this tip is to help you feel better, non-medicinally and naturally. Tip number one on preventing neck and back pain. What I've noticed over the last 20 years in practice is human beings, we tend to do this. We sit and type, we sit and sew, we're on our phones, on our tablets, or we read like this. So I've noticed human beings roll their shoulders forward and their head comes forward, which tightens neck muscles, starts to irritate discs and nerves in the neck, starts to stretch back muscles, and can cause shoulder pain, numbness, tingling down to the hands, as well as neck pain and headaches. So one way to prevent future neck pain, headaches, shoulder pain, numbness, tingling to the hands, as well as chest pain, is to stretch. So I'm going to give you 2 stretches in order to reduce your risk for feeling this way. Now remember, as with all stretching, it's slow stretch, slow release, slow breathe, and I recommend twice a day. Once in the morning before you head off to your day, and then once in the evening before bed. So let's talk about the first one. The first one, we're going to take our left arm, we're going to bring it down to the side, take our right arm, we're going to bring it over towards our ear, over our head, keeping our nose and our chin level to the ground and our eyes level. So we're going to slightly grab our head and take a big deep breath in. On the breath out, we slowly keep our shoulders down, our eyes level, and our chin and nose level, and we breathe out and we stretch. We hold it. We do it again. Slow breath out. And we stretch for a final time. Breath in. And a slow breath out. And as we breathe out, we slowly release our head back to center. The key is to keep the nose, the chin level. Do not bend your head forward or backwards. Keep your eyes level and your head straight. I'd recommend you do that on both sides, once in the morning and once in the evening. Now, to help open up the shoulders, relax the muscles in the middle back, we want to take our arms, we want to bring them to our side, we want to push our arms down and our shoulders down. We want to pretend that somebody's got a string on our skull and pulling our head up. So we want to stretch down and take a big deep breath in. And then on the breath out, we want to drive our arms and our shoulders down and our head up. We want to do that a second time. And then on the third time, when you breathe out, you want to tilt your head back and really drive those shoulders down. Everything is slow, and I recommend we do it twice a day. Once in the morning, once in the evening, and if you're at a desk job or you feel like things are tightening up during work, I highly recommend you do that as well. But please remember, slow breathing, slow stretching. Tip number 2 for preventing future neck pain. Coming to you from the floor. That's right, you'll be on your floor. Now, in my book, Never Look Back, a simple guide to the causes and care of back pain, we talk about what the normal neck should look like in order to have a healthy neck and a pain-free neck. We talk about having a curve in the neck that looks like a banana that measures 43 to 45 degrees. But the problem is when we human beings lean forward all day long on our phones and typing and sewing, we start to drive the head forward and we start to lose the curve of the neck. And when you lose the curve of the neck, you can damage discs, you can pinch nerves, and you can start causing neck pain, shoulder pain, numbness, tingling down into the hands. So one thing that you can do to help restore the curve of the neck or prevent future loss and future neck pain is by taking a hand towel, rolling it up concentrically, maybe to about 3 to 4 inches, and then we're going to place it on the floor. We're going to lay back, and we're going to place it right where our neck meets our shoulder, and we're going to lay over it with our arms relaxed. And we can do that for about 3 to 5 minutes, because what that'll do is that'll help put that curve back in that neck. It'll help relax the muscles and prevent future disc and nerve injuries. So after about 3 to 5 minutes, we'll slowly turn our body and slowly we'll sit back up. Now, dizziness is normal as blood flow will go back and forth to the brain. We'll relax and take a big deep breath in. We'll blow it out. Now, I recommend you can do this twice a day. Again, once in the morning and once in the evening, or as much as you like, but I recommend at least twice a day. Tip number 3. We're going to show you how to prevent future low back pain and future pain in your middle back. There's a muscle in your rear end called the piriformis muscle. That's called the pear-shaped muscle that sits in the middle of your rear end cheek. And when it tightens, it pulls on your pelvis and your low back. So I'm going to show you how to stretch the piriformis muscle in order to prevent future low back pain. So what we're going to do is we're going to take one of our legs. I'll start with my right. I'll bring it up and sit it right on my knee. I'm going to take both hands. One will go on my ankle, one will go on my knee. I'm going to sit up tall. I'm going to take a big deep breath in. And then with my back straight, I'm going to breathe out. And I'm going to lean forward with my back straight. And I should feel a nice stretch in the middle of my rear end cheek on my right side and on the top part of my rear end cheek. This is stretching the piriformis muscle and relaxing the muscle. And then we're going to do a total of 3 times. We'll take another deep breath in and slowly we're going to blow it out. And then one last time. Blow it out. And we're going to feel that nice stretch. And then we're going to sit up and we're going to put our leg down. And we're going to do that on the other side. Again, as with any stretch, I recommend you do it in the morning and the evening. And you can do it more than that, but at least morning and evening. The next stretch we're going to teach you is for that middle back. Middle to lower back. And what we're going to do is we're going to sit up tall. We're going to take our one hand, let's say our right hand. We're going to put it on our left hip. We're going to put our left hand on a chair. We're going to take a big deep breath in while we sit up tall, look straight ahead. And when we blow it out, we're going to slowly twist our entire body while pushing on our thigh, and we're going to hold. We'll take a big deep breath in again, and we're going to blow it out. And then we'll do this one more time. And then slowly relax. As with all stretching, we recommend it's slow, not ballistic. We recommend twice a day at minimum, and you can do it more. So those 2 stretches are going to help prevent future low back pain as well as future middle back pain. Hey guys, so let's recap what we've learned today. Number 1, we've learned how to get rid of back pain and neck pain non-medicinally. We talked about moist heat and ice. And then I gave you 3 tips, 2 for the neck and 1 for the low back. We talked about stretching the neck and the chest. We talked about using a towel rolled up to help put the curve in to relax all of the muscles and help the discs and the nerves. And then we talked about stretching our low back and stretching our mid back. If you liked all these tips, I'm going to share with you that in my book, Never Look Back, A Simple Guide to the Cause and Care of Back Pain, I share more information. We talk about what a normal back looks like, what an unhealthy spine looks like. We give you tips as to what your pain could be coming from, as well as I tell you how to diagnose where the pain is and help you and your doctor figure out. And then I share with you a non-surgical solution to back pain that has been working for quite a long time, especially in our office. I want to thank you for all of those that purchased my book. And for those that haven't, I highly encourage it. It's such a simple guide to the cause and care of back pain. And I want to encourage you to share these videos, share these tips with the rest of the world, because too many people suffer from neck and back pain. And I'm on a mission to help get those patients the information they need to help change their life. Because in my practice, when I help patients with neck and back pain and their pain goes away, they never look back again. And to see the joy in their life and their face drives me. So I want to thank you for coming to this video today. I hope it helped you out. Please check out more videos. Check out our website. Go grab our book online today.